Good evening friends and welcome to my channel. So today I am with the answers to my previous episode of questions on the parotid gland. So first question was parotid gland is located. So the location of the parotid gland just in front of your pinna below the zygomatic arch, and it may go up to the lower border of the mandible and in the recess between the angle and the this portion behind the angle. So the main importance of this is whenever you find any swelling here on the face lower part just above the mandible or below the mandible in front over the cheek, so you must anticipate that it could be from the parotid gland. And the most common swelling that is arising from the parotid gland is the pleomorphic adenoma. So many times it is confused with your lymph node that is present in the neck. So that has to be avoided. The next question is superficial parotid gland constitute the percentage of total gland. So this superficial gland constitute 80% of the total gland and the rest of the deep portion constitute the 20%. So which structure divide the parotid gland into superficial and the deep parotid? Suppose this is the superficial part and this 20% is the deep part. So actually it is a continuous tissue, but the nerve which passes through is the facial nerve and its branches. So this facial nerve is the structure that divides the parotid. Though the part of the gland which is superficial to the branches of the facial nerve is known as superficial part, and the structure or the part which is deep to the branches of the facial nerve is deep part of the parotid gland that constitute only the 20%. Treatment of the parotid abscess. So here it is a confusing question. Many students confuse that the normal treatment of abscess is drainage of the abscess, but in case of parotid it may be different. So you must remember that abscess anywhere in the body, whatever structure it may be, it has to be drained. Otherwise what happens with time, it will find its place by slowly destroying the structures, and ultimately it will be drained. Suppose here the abscess is there, so these are the structures. So slowly there will be destruction and there will be passage and the drainage of the abscess, that is the spontaneous drainage. So why even the small parotid abscess is so painful? So you must know all these visceral structures have stretch receptors, and these stretch receptors are stimulated only when these are stretched. If you cut these structures, you will not feel any pain. If you cut the intestine, you will not feel any pain. If you stretch the intestine, as it occurs in the intestinal obstruction, because of the filling of the intestine with the gas and the fluid, there is stretching of the wall that causes the pain. So in case of parotid abscess, the fascia which is surrounding, let me draw with this pen. So this is the, suppose this is your parotid gland and here is the fascia. So this fascia is very tough and it is non-elastic. So slight increase in the tension, it puts lot of pressure over the fascia. So even a slight increase in the volume of the parotid gland because of the formation of the abscess put a lot of pressure on the fascia and it causes severe pain. So parotid duct is also known as and opens at. So this parotid duct is known as Stenson's duct. S-T-E-N-S-E, Stenson's duct. So this Stenson's duct originates from the anterior part of the parotid gland, then it runs over the masseter muscle just finger below the zygomatic arch, then it pierces the buccinator muscle and opens at the just near to the second upper molar tooth. So you can nearby that you can see the opening, and when you ask the patient to have some sour or bitter thing, you will see that the secretion coming out. Even in case of inflammatory or infective pathology, you will find that the pus is coming out from that opening. So what is the importance of knowing this duct opening? Many times when the patient is wearing your denture or some tooth is having the sharp spicule, that causes the continuous irritation over the papilla. So with continuous irritation, there is damage to the surrounding structure, to the papilla itself, and the healing causes the fibrosis leading on to the obstruction. If that is not treated in time, ultimately there will be permanent fibrosis and lead on to the obstructive parotitis. So name one autoimmune disease in which the parotid, that is the Sjogren syndrome, is that one. You can see the autoimmune disease that can involve all the salivary glands of the mouth, that is your submandibular glands, small glands, parotid glands. Along with that, it also involves the your lacrimal glands. Dryness of the eyes and the dryness of the oral cavity lead on to many problems. Stones are common in which salivary gland and why? So here, as you know, all these secretions contain many chemicals. So whenever there is stagnation, there is precipitation of the secretions, and when these secretions are precipitated, the solutes which are present, they form a first thick solution, then ultimately further absorption of the fluid from that lead on to the formation of the stone. So if you find this parotid duct is going straight, but in case of your submandibular, it goes like this and opens like this. So it has to move against the gravity, and there are lot of chances of stagnation of the submandibular secretions in the duct. So these are released when the patient is eating something, the pressure increases and then it is released. So when the oral hygiene is good, the duct openings are good, there is no trauma, so the chances of formation of the stones are very less. But whenever they form because of the stagnation of the secretions. Which salivary gland stones are radiolucent and which are radioopaque? So most of the time it has been observed that the stones which are present in the parotid gland are radiolucent, and these are not visible on the X-rays. And even CT scan uses the X-rays, and you cannot visualize these stones on CT scan. So whenever we are planning for the management of the stone of the parotid gland duct, so we have to rely on the ultrasound instead of the X-ray or the CT scan, because with ultrasound we can visualize and localize the stones where these are present, and whether the stone which is palpable or visible into the oral cavity producing the lump like structure. So that is stone or some other small stones are present or not. We can do the ultrasound and we can see whether the multiple stones or single stone is present. But in case of your submandibular gland stones, these are radioopaque and we can easily see these stones are on X-ray or the CT scan. How will you diagnose parotid gland stones? The answer lies in the answer of 9. Because these stones are radiolucent, so we can diagnose by taking the history, which is producing history. The patient will say that the symptoms associated with the intermittent parotid obstruction, that means whenever the patient starts eating, there is increased flow of the secretions, and that causes stretching of the parotid gland, and then ultimately the fascia, the pain will be there when the patient start eating or when he smells a good food. After some time the swelling decreases and the pain also subsides, because with the passage of time slowly and slowly the secretions come out through the partial obstruction caused by the stone. So we can, one is this history and other is we can palpate the stone, we can sometimes feel the stone if it is superficial in the duct, and we can localize the stone with the ultrasound, not with the CT scan or the X-ray, because these parotid gland stones are radiolucent. Thank you very much, and please do subscribe and like my channel, and in the next video I will give more questions on the parotid. We try to cover whole of the parotid gland in 2 or 3 videos. Thank you very much.